Biodiversity, next slide, please. Sama is our lead on this program, and essentially, I'll try to make this story short, but I run a tree charity in Hamilton. Is one of the things I do. We've been doing this for 15 years, and we have scaled this up nationally, probably 3, 4 years ago now, and we have partners all across the country. Bottom line, if anyone in this group wants to plant trees or shrubs or pollinators at their health facility, let us know. That's it. And we'll get you set up. Okay? Um, so many benefits to trees and pollinators for our health and obviously for a healthcare facility. Next slide, please. Oh, this looks like this is going to be Will. Is that right?
Yes, this is Will.
So Will, Northwest Territories, he's not here tonight. He's going to present 2 programs, I think.
Yeah.
Okay, let me know if you can hear the audio.
For the Canadian Coalition for Green Healthcare. I'm sorry that I can't be joining you right now. I will be in a time zone a bit too complicated to make this happen. And so I'll give you an overview of 2 of the projects that I'm leading. The first one is our low carbon heat health solutions in care settings. And in this one, we have data loggers measuring temperature and humidity that we've installed in Halifax, Hamilton, Ottawa, as well as Vancouver. We have over 150 of those collecting temperature and humidity to assess for heat risks in summer months. So we've installed the data logger last year, as well as a extensive survey and interviews of patients. So those loggers are installed in home care, in hospital rooms, as well as in long-term care. And then this year we are installing mitigation solutions. So shades, fans, cooling neck towels, and we're going to be testing those out and issuing recommendations as to how we can best protect the elderly and vulnerable population for heat waves, but also for interrupted power supply. And what do we do? How do we deliver? How do we make sure that we can stay cool when there's no more electricity? The second project I'm leading is our Decarbonization and Action project that we started in the GTHA, Toronto and Hamilton area, where we're providing one-on-one support with some hospital staff, both clinician, but also facilities and engineering folks, to help them identify business cases, as well as implementation solutions to accelerate decarbonization. So that could be getting rid of sterile bottled water for endoscopy. That could be getting rid of desflurane, eliminating nitrous oxide leaks, and whatnot, because we realize that physicians have a lot of leadership and authority, but they don't have time. And so how can we align clinical teams with facilities teams? We're also facilitating cross-hospital learning. We don't need, 13 anesthetists and 13 different hospitals figuring out how to decarbonize anesthesia. We could just need one and share the best practices. We're also developing the Solutions Atlas, which is a catalog of climate solutions applicable to healthcare, alongside like the tools you might need, the toolkits, peer-reviewed evidence, and whatnot, in order to accelerate the uptake of those decarbonization solutions. And with that, I'll pass it back to the team. And thank you so much for your interest in having us speak to your group.
Hi, everyone. My name is Lisa. I'll be presenting the primary care section of the presentation. Can everyone hear me? Okay, perfect. Yes. So could we do the next slide, please? Awesome. So my name is Lisa. I work as the project manager for the Green Initiative at the Hamilton Family Health Team, and we're the largest health team in Ontario. I'm also a PhD student at McMaster University, where I study social medicine, and we're trying to integrate a food prescription model into our city. So here we're presenting 4 key initiatives that ground the primary care work. We are the primary care arm of the Canadian Coalition for Green Healthcare. And so all of our projects are based on our findings from a narrative review we conducted earlier in the year. It's called the Primary Care Fruit Tree, and I welcome you to check it out, where we outline all of the different types of solutions that can be integrated into clinic to reduce its environmental footprint. And we actually outline not just the impact, but we outline how difficult it is to embed it based on hours needed to implement this over the year. So next we are hosting a Green Office Challenge, which is a questionnaire based on the primary care fruit tree that we sent out to all of our clinics within Ontario and beyond. It is a national challenge, and this is aimed to identify which clinical initiatives are being implemented in different clinics across the country and how we can support people to implement those initiatives. And the way we support people is through two key avenues, which is the Clinical Networking Hub, a space for clinicians to connect and learn about different types of initiatives. So we do have a speaker come in to this bi-monthly meeting, and we have a Q&A session where people can ask questions and connect over certain types of topics. And then we also have the Green Initiative Guided Leadership and Sustainability, which is a mentorship program aimed to provide one-on-one support to individuals aiming to implement something into their clinic. And our participating clinics, some of them come to us saying, we saw you in a webinar, we don't have any green initiatives, but we're really interested in implementing something. And then we work with them to develop a strategy and like support them in integrating this into the strat plan or adding new initiatives into their clinic. Or it could be a clinic that comes in and says, we have all of these things implemented, but we have a specific initiative we don't know how to implement. Do you have resources, etc.? So we really try to adapt the approach to the specific clinics. And yeah, if you're interested, please do reach out to us, and we'll get you connected with a mentor, get you started. Next slide, please. We also collaborate with Will and the Atlas and a couple of other coalition projects to develop patient and clinician-facing tools to accelerate and facilitate the integration of sustainable initiatives into practice. So we have a variety of toolkits, information guides, and posters that can be posted around the clinic. And we're also always happy to collaborate and create new tools based on your there's a question also. We can discuss that in a second. Yeah, but based on your needs, we're happy to develop these different tools. Yeah, that's basically the summary. Can we see the next slide? Is there anything else that I missed? Oh, yes, we did have a few recent publications. So I truly invite you to check out the low carbon fruit tree, which I did mention earlier, the environmental elephant in the office. So looking at medications, the environmental impact of overprescribing, but also the issues with underprescribing, and of course, over-the-counter medications, which are often overlooked as something that can impact the environment, but also the health of the patient. And of course, the journey of a pill, which follows the pathway of a benzodiazepine and all the different components that are actually go into the pill, and how it's truly a global initiative to create any sort of medication, especially something that's prescribed and prescribed often. So really invite you to take a look at these publications. Next slide, please. Okay, great. And I'll just address a question here, unless... Oh, yeah. I do have to run, but I'm happy to add my email in here, or happy to answer any questions you have now as well.
It isn't anything specific, Liza. Thank you so much for introducing us to the great work that you're doing. As I had mentioned in the beginning, and I'm not sure if you were there, I haven't thought of exactly how I want to do it, but I feel strongly about these initiatives, and I'm sure that our clinic could do, so much of work in this regard. But I wonder how are you able to help us as part of the Hamilton group in Saskatchewan. So what I was thinking of was we have session called faculty development, and we bring in topics that are interesting to us. I could put it up to the committee and see if they are interested in this. That way, at least my group of physicians, and we are a group of 20 physicians and about 36 residents, because I'm part of the faculty of academic department of family medicine. So I think this is something that we need to introduce to our department. Would you be willing to say do a session, a lecture for an hour, and then introduce some of the things that we can implement in our department?
Yeah, thank you so much. Certainly happy to support. Myles and I have a set slide deck that we can share and present to you with that summarizes all the content within the paper and also provides some practical tips on how to implement. And then we can kind of even do a workshop session to support you and meet your goal. So yeah, please do connect with me after this call and let's get something set up. That's really exciting.
Perfect. So I'll just, I guess I can take your email ID from Murray.
I can just message it in the chat as well, but yeah, let me do
Great.
that.
Thank you.
Yes, thank you. Looking forward to staying in touch.
Okay, so I guess I'm up next here. So my name's Autumn. I am a project manager with the coalition. As Miles said, I've been around only a few years, longer than he has. I started out in primarily a marketing and outreach role and then kind of graduated to managing my own projects. So most recently is this one, preparing Canada's healthcare buildings for net zero. This is a 3-year initiative. We're in our last stretch here. Will be done in March 2027, but basically, the goal of this project has been to accelerate the readiness of the Canadian healthcare workforce and leadership to undertake climate change mitigation initiatives that will reduce greenhouse gas emissions from healthcare buildings such as hospitals, health centers, clinics, and long-term care. In particular, we've been targeting 3 different types of emissions, so primarily fossil fuel use in buildings, nitrous oxide leakage from bulk storage and distribution systems, and hydrofluorocarbons used in meter dose inhalers. Seems like a bit of a random mix, but it was really Environment and Climate Change Canada that brought this funding opportunity to us and was like, these are the various emissions you could potentially address, and these are the ones they had that were related to healthcare. So we're like, we'll do all of it. But yeah, so we have kind of 4 different areas of focus addressing those emissions. So we have the low carbon inhalers, green teams. So that's kind of this workforce development piece, our Nix the Nitrous initiative, and then also our work with low carbon energy planning and baseline GHG measurement. We have a bunch of different ongoing initiatives and resources and things that have been developed and are in development. So this includes guidebooks and toolkits, fact sheets, webinars, case studies, networking hubs, and more. Next slide, please. And this shows just a couple of the things that we've done over the last 2 years. So we have our large repertoire of various guidebooks for specialties. So you can see the one here, which is for cardiology, but we have rheumatology, psychiatry, emergency medicine, ICU, you name it, and we have a bunch more in development as well. We've also developed a nitrous oxide toolkit, so central supply system deactivation guideline, a checklist. We've also released a few low carbon energy fact sheets with lots more in development. We've done a variety of webinars on all of these topics. And then most notably, we have our networking hub. So we have a low carbon energy networking hub, which meets monthly. And they're working on low carbon energy road mapping. We also have a Green Teams networking hub, which meets bi-monthly. And we basically have experts that come and present on a variety of different topics and or present on their green teams and their work in green teams. And then as Liza mentioned, we do have our clinics networking hub, which she helps lead. So that is under this project as well. Next slide, please. So I really wanted to just say a couple extra things about our Nix the Nitrous. So most recently, something that we've launched is our Nix the Nitrous recognition program, which we're really excited about. So this is recognizing healthcare facilities across Canada who have decommissioned their essential supply systems, whether they've only partially done it, whether they've fully decommissioned, or even if they're just planning to decommission, they can sign our pledge. So a wide range of opportunities for anyone who's taking this path for decarbonization. As we know, nitrous creates a huge footprint. So really it's about just recognizing all the hard work being done, all these champions, that we have across Canada. And so we're providing certificates of recognition. You can see a little sample there. And we're also putting all of the participants on this case studies map which is a Google map, just to kind of show what everybody's doing, basically. And again, just a testament to all the amazing work that's being done across Canada. Next slide. So these are kind of my QR codes, but I will put the link in the chat to our web page, and I will also add my email for any information about this. Also, I'll add a link for our networking hubs if that's something you're interested in. There's a bunch of sign-up forms on our website for those. And then I also encourage you guys to sign up for our newsletter. That's something else that I run. That's been my baby over the last 5 years. It's a bi-weekly newsletter, but that's where we share all of our project updates, all of our new resources, opportunities, events. We do tons of webinars. So yeah, again, I'll put the links in the chat for you guys, but thank you, and thanks for having us here today.
Yes, it is a great newsletter. Thank you, Autumn. All right, back to me, food. So we started a food group. This actually started in Ontario. It was initially an Ontario group. Next slide, please. And we reached out to various food groups that are out there. I'm not sure if you've heard of Nourish. Nourish has been around for probably 10 years now, so they were a key group to have. And over time, we had a lot of interest from other people, and so now, gosh, I don't chair that one anymore. So I'm, still a participant. Fiona would be the one, Parascandello, presenting this, but she's not here tonight. But we still meet every month or two. And our goal, we usually have a goal every year. We decide democratically as a group. A few people have put ideas forward. What should we focus on this year? And I'll show you a couple of the things that we have focused on and have now finished. Next slide, please. So a couple of years ago, the focus was making a business case and implementation guide. So you could look this up on our website. And essentially, it is looking at plant-based eating, which is certainly in line with Canada's food guide. I think that if you look at Canada's food guide, I hope I get the number right. I think about 87% of the foods within Canada's food guide, what we're suggesting to eat, are plant-based foods. Now, tons of literature out there to talk about the benefits for patients. But interestingly, the business case is that this actually saves money to be having plant-based items instead of animal-based items in a hospital setting. I also need to make it clear that we do not try to tell hospitals to become vegan hospitals. We're simply talking about a shift to maybe 20% more plant-based. Next slide. And the big project we just finished last year, we often talk to physicians who have nothing to do with the menu or what patients eat. I mean, they might be working in the anatomical lab or something. But if you're organizing a conference, how can you make your conference sustainable, and what might you have in terms of eating at that conference? So we just finished this one about I wanted to say a month ago. It says December 2025. Time flies. So this is another resource that you could look at. Next slide. And these are the pillars of our group, the things we focus on. We do have a couple of Cape Docs from Ontario in our group. Next slide, please. All right, this looks like plastics.
Yeah, so it's me. Hello, everyone. My name is Sandra Alexander. My background is in global health, and I bring that to my role as a project manager at the coalition. And so my project is called Circular Clinical Care, which is a national 3-year initiative being undertaken with the financial support of Environment and Climate Change Canada. And the goal is to reduce plastic waste across 4 categories that we've identified as hotspots for plastic waste in healthcare, which are perioperative care, packaging, textiles, and food-related services. So for the first year of the project, we partnered with Hamilton Health Sciences, which is a large network of hospitals in Hamilton, Ontario, where we have been implementing projects and seeing what works and creating case studies, business cases, videos, project plans, and staff training materials for various plastic waste reduction initiatives. And now we are in the final year of the project where we are taking all of those lessons that we have learned and the materials that we've created to develop something that we're calling implementation packages so that we can bring these projects to other hospitals across the country. And throughout the full duration of this project, we've partnered with McMaster University's postgraduate medical education, where we specifically collaborate with medical residents to implement quality improvement projects. And we also collaborate with Peach Health Ontario for data collection. And so on this screen, these are just 6 of the 10 initiatives that we have written a case study or a business case for. Some projects involve patient engagement, like having patients bring their own reusable bag for day surgery. Some projects involve more procedural shifts at the clinical level, like using tap water instead of sterile bottled water for non-sterile endoscopy procedures. And then there are other projects that involve actual product substitutions, such as switching from disposable surgical masks to reusable ones. And overall, it's a massive project with many moving parts because there are just lots of opportunities for change. And so if you're interested in learning more, I'd love to chat. Thank you.
One more, and I think it's me again. You almost had the real deal, Ari. As you know, we all came an hour early. So Healthy Capital Program. This one's kind of interesting. You see the Trache logo on the bottom there. Trache is a foundation in Montreal that is interested in climate and health. So I work at McMaster University, part of my day job, and we were aware a few years ago the students at McMaster University went on a hunger strike because of the amount of investment the university foundation had in the fossil fuel industry. And the students were upset about that. That got me interested in what hospital foundations invest in. And quite interesting because a lot of the big universities across Canada have moved away. I'm talking again about the universities have moved away from fossil fuels or decreased their investment. But very, very few hospital foundations have done so. In this project, we reached out to 80 of the biggest foundations in Canada. I think they had about $10 billion in assets collectively, and tried to see their interest. And we do have about 10 that are doing a community of practice with us, and we do have a lot of the big ones in that group that do represent a few $1 billion of assets, and we're basically educating those groups. Have various investors who help with those portfolios to say, gosh, do you realize there are things you can invest in which are good for the community and for the health of the community, and you won't lose money doing it. Next slide. And so we are in various program phases. We are now basically between the blue and the green phase here. If you do work at a hospital that you think your foundation would be interested, and I realize I'm talking to Saskatchewan and it might be a sensitive issue, let us know. Next slide. And so this is the sustainable spectrum we talk about, from traditional investing through to negative screening is in the middle there. That's what I'm talking about. So, for example, 20 years ago or more, most foundations in Canada would have gotten out of cigarettes, which makes sense, but we still might invest in weapons or oil, which are not good for our health. And then you can move right over to what we call impact investing, where you're actually looking at ways to improve the health of the community. Next slide. That might be it. All right. Well, thank you very much for listening. How do we do tonight, Ryan?
Excellent. Thank you so much for joining us.
So next time you're going to have to join us, because you've probably got it memorized by now. I think this is number 3 for you, right?
It is. That's right.
You probably had a different mix of people every time. Thank you all for having us tonight. And if you have any other questions, we're happy to answer, or we can move along and let you get on with your meeting.
Well, we really appreciate you coming in. I know that time change from Ontario has made things like. Did I hear you say, Myles, you guys arrived an hour early because Saskatchewan's time?
We had a little. We all popped on. It took us about a minute to realize, you know something? Saskatchewan here.
Well, we really appreciate you attending tonight, and actually all of the sort of ways we can access the project pages and the networking hub sign up. And so now I think myself and mostly I'm going to really review your website and get to know more of it. And so I'm wondering if Dr. Rob Weiler, who's an anesthetist, just joined us, and I'm not sure if you have any questions, Rob, after hearing our presentations.
Yeah, I really enjoyed the presentations. Actually, I do have. I'm just a matter of how do we go about sharing some of the work? Because one of my areas of interest has always been reusing our single-use items that we have both in the operating room and throughout the hospital in general. And I know Health Canada has got lots of guidelines that have never been sort of promoted in terms of how we can reprocess, for example, many things that are said to be single-use, but we know they could be used more than once. So is there some way of somehow spreading, because I'm sure that throughout the country, there's a variety of pockets of projects that have been done to do that start of either reprocessing or reusing or trying to minimize that. Is there some way of kind of looking at what other centers have been done? Is there some sort of centralized process we can then see if there's some things that we can adapt in the same thing without having to go through all the work of trying to sell the safety and the practicality?
Absolutely. That work is being done. Absolutely. Sandra may have something she wants to add here. I'm not sure, but if you've done anything on that side, but I'll say a couple things. One, I would say as a group, one of our biggest successes is the fact that we've gotten the attention of Accreditation Canada. And in June, we will be putting out what we used to call a Green Hospital Scorecard. It's now, I think, called a maturity matrix, and we'll be doing that in partnership with Accreditation Canada. It's roughly going to be 50 questions, and there's a few anesthesia questions, and there's a few separate surgical questions. And so every hospital in Canada will see this. It's voluntary at this point, but the idea with Accreditation Canada is that over a period of time, this will become mandatory. So that's pretty exciting that Accreditation Canada is getting behind this, right? The other thing, I don't know if you're aware of the Ontario anesthetists, Robert, who've done like a ton of work. Banning does fluorine in Ontario. And so there's all kinds of docs there that I could potentially put you in touch with. And there's also someone named Stefan Williams, an anesthetist in Montreal, who's making something called the, what does he call it? Is it called the ECHO score? Is it I think it's the ECHO score? Which is for hospitals to look at their surgical stuff, and it includes anesthesia and single-use products, et cetera, et cetera. Stefan would talk to you one-to-one. Super busy guy, but he's passionate about this. He would be a great person to talk to, and he'd probably know all the items that are kind of doable in this regard. Sandra, was there anything else you wanted to say about the plastic side?
Yeah, I just put a link in the chat. So last November, the coalition hosted something that we called Plastics Reduction Week, where each day followed the theme of the branches of the project. And these videos or these webinars that are on YouTube now kind of go through some of the implemented projects, like how were they implemented to reduce single-use plastics, or simply just talking about what are some opportunities that we've identified. And so that could be another resource to get inspiration from. But yeah, I also agree with Myles and his comments.
Thanks, because there's just so many things that we see. So throughout the hospital system, not just in the operating room and anesthesia, but syringes in Saskatchewan are come wrapped in a variety of packaging. And some of the packaging is paper with very little sort of attached plastics, and most of it can be managed much more easily, where much of our, say, syringes literally come encased in a second piece of plastic, which is usually bigger than the actual syringe itself in terms of plastic that's just disposed of. And so I guess what I was looking for is to see whether or not there's arguments to be made from some of the bigger purchasing areas, like in Ontario, the hospitals perhaps, to see whether they can put pressure on the manufacturers to package the things that we use more reasonably. And then, of course, there's a whole separate thing that I've had interest in, and that is the tools we use in anesthesia, disposable laryngeal mask versus reusable, for example. So again, I was just looking to see how to connect or look at the summaries of projects that have been done in other hospitals, so we don't have to.
Yeah, absolutely.
Yeah.
I mean, that's really what we're all about, Robert.
Yeah.
That's really what we do. We find out ideas that work, and we try to scale them up nationally. So we can definitely get you in
Okay,
touch.
great. That's all I really wanted to.
Yeah, excellent.
Thanks.
Excellent. Well, thank you all so much, and we'll hop off, and let us know if you need anything.
Thank you all so much.
Yeah, I think Murray was saying something there.
I was muted,
Yeah.
sorry. I just said thanks very much for attending our meeting tonight and bringing us up to speed. Super important projects you guys are all involved with, and we really appreciate your time and all the work you're doing to green healthcare.
Yep. Thanks again.
Good night, everybody.
Yeah, good night.